some women want to achieve that push-up bra look with surgery, but is it a good idea?
Well, in my opinion, it's not. And I tell you why. Because if you have that look, it means that you've probably put too big of a device or not put it in the right place. And even though they want that look, they're not going to like the long-term consequences.
All right, now I totally disagree. I just don't think that that's a reasonable approach. And if we had that approach on all the patients that come to see us, we probably wouldn't be fixing very many people.
But Simeon, are you saying if they want it, they get it?
No, of course we don't. Nowadays with breast surgery, we know that we want to really pay attention to the tissue characteristics of each patient. And we don't want to exceed the width of the breast. We know all that as plastic surgeons, and we, of course, want to educate our patients. But I think it is reasonable when they come in and they've got very low positioned breasts on their chest and they want more of a push-up bra look, it is reasonable to be able to deliver a very predictable surgery that we can reproduce over and over with a very low re-operative rate. I think it's reasonable.
Yeah, but I don't think your re-operative rate's going to be low, and I think that's the message that I try to get to my patients. You know, what agenda do I have? If it doesn't matter and they want that look, I'm not the one to judge, okay? But I want them to have good long-term outcomes. I don't think you get it when you get that too big of a look and push-up look.
Well, all right, so I would argue that my surgeries probably have more longevity than yours because maybe when they're younger, we're trying to position that breast a little higher on the chest, possibly with a lift as well as with an implant at the same time. And that as they age and maybe as they get older and it's more age appropriate for it to sit a little lower, sure, it's going to sit a little lower as they age. But your surgeries, if you never really reposition it upwards, they're going to stay kind of low and matronly the whole time. And,
matronly?
And my
You're
patients
calling
wouldn't
my
accept
results
it.
Matronly? Simeon. Oh, well, listen, I think we just have to agree to disagree on this one, buddy.
Absolutely. All right.
And great topic. Thank you, doctors.